Good afternoon, and thank you again for joining us today for this webinar that we hope is going to be very impactful, not only from you as an individual, but also your businesses and the employees that you employ. Obviously, as you're seeing in the news, the Delta variant surge is upon us. You're also going to find out today about some issues that hospitals are already dealing with beyond the surge of this Delta variant. And so there's a lot of information that we're trying to, as quickly as we possibly can, get in the hands of as many people as possible so that we can encourage those that have not been vaccinated to do so as quickly as possible. So we did this yesterday at 10 o'clock and it ran truly a full hour. So I am going to not say much here other than to introduce our panelists for today. First, we have Colonel Rob Gator Ader, as he's known as. Gator is retired colonel from the U.S. Air Force. He is working with the Arkansas Department of Economic Development, but also, more importantly, tasked by the governor to be the COVID-19 vaccine program manager. So from a logistical standpoint, he's been at the helm of this thing from the beginning. So we're going to hear from him and where we are today, as well as from Mike Moore and Wayne Young from the Friday firm, talking about what businesses can do now as we move forward in trying to get folks vaccinated and hopefully stop this surge. So with that, Gator, I'm going to turn it over to you and reference the fish graph that we've talked about that really kind of tells the story of where we are. If you will, set the stage for what's going on, where we've been, where we are now, and hopefully where we're going. And then we'll turn it over to Mike and Wayne from the legal aspect of it. So please welcome with me, Colonel Retired Rob Ader, the COVID-19 vaccine program manager for the state of Arkansas. Rob?
Well, thank you, Jay. And really thank you for putting this on, because you know, we've kind of run into kind of a buzzsaw, you know, and I will tell you from where I sit, the programmatics of how we're doing as a state, actually, by every measurable standard, we are absolutely knocking it out of the park. The only thing that we suffer from is the number of Arkansans that have been vaccinated. And so there's a lot of different reasons for that. And so I kind of want to set the stage just a little bit for you. You know, I came on, the governor asked me to go over about mid-January, and the whole purpose of what he wanted me to be able to do is to stabilize the delivery of the vaccine out to the state. And if everyone can remember, at the time, the demand was just off scale high, and yet the supply of vaccine coming to the state was ridiculously low. For a state with over 3 million Arkansans, you know, we were getting at the time about 25,000 doses a week. And because of that, then we had this high demand. We had a phased program for how we were going to inoculate our population. But more than that, there was a lot of you know, fear, and there was a lot of confusion about where that people could go when they were opted, and where was the vaccine and how could they get access to that vaccine. So a lot of the effort was really initially set to try and stabilize the flow of vaccine to the state. And I did that. At the time, we had about 230 providers around the state. And then, you know, as we have progressed, I've increased that size by about 800%. So today, we have about 1,800 different providers around the state. So we have it in every nook and cranny. But if everyone remembers that we were kind of going through these phases, and then the first phase was our healthcare workers and our first responders. That was phase 1A. And then we went into 1B, where we started looking at critical infrastructure and critical employees and getting them so that society continues. But also in that 1B population, as we went after the most elderly, which were the most at risk. So we started with 70 and above, then we adjusted it to 65 and above, and then we moved through the companies. And then the 1C population is when we started getting into people that had comorbid conditions and other companies that were going to keep society rolling. If everyone remembers, we went through those phases kind of slowly at the beginning, and that's really a reflection of the dearth of vaccine that was coming to the state. But also we got into towards the middle of March, where the demand started dropping off, and we really went through the phase 1B and 1C rather quickly. Part of that was we were trying to make sure that we were, getting companies vaccinated and their employees vaccinated. And we moved so quickly through that because of the lack of demand that we didn't afford all the different companies out there an opportunity to get the vaccine. And so now we're trying to go back to those companies and say, hey, look, we want to be able to try and help you get your workforce vaccinated for the long-term health of your company, but also your employees. And for an old Air Force guy, it's always about mission and airmen. And so that is key to our focus. But as we went through that phased approach, one of the things that we did really, really well was that I took about 15% of the vaccine that was coming into the state, and I dedicated that towards our minority community. And if everyone remembers that, there was a lot of discussion about the Tuskegee experiments, and also with, the Hispanic community and the fear of that ICE would, or their information would be taken and face other threats. And so I wanted to carve out about 15% of the vaccine that was coming in the state and dedicate it towards those groups to try and get some early adoption into those communities. And we did that really, really well. And one of the things I take a lot of pride in the fact is that the state of Arkansas, even though it's a small, rural southern state, leads the nation in equity in providing vaccinations to our citizens. So, but there's lessons to be learned from that. And that's the reason why I bring that up. Because we were working locally with the local communities, we were able to get those early adopters. And so the lesson to be learned through this is that trying to stay within pathways of trust. Now, that may be a community organization. It may be a church group. It may be an employer. You're part of that. And so what we want to be able to do is work with you to stay within that pathway of trust to be able to get that vaccine out to your employees, because you're kind of one of the linchpins of where we are and what we need to get past what I term that movable middle. Those are the people that were early adopters, they've already been vaccinated. And that's where we sit today as a state with our population 18 and above, the adult population being vaccinated at about 52.3%. As a state, when you include all the population, to include those that aren't eligible, in other words, the kids, we're at about 40%. So we have work to do. And it's important that we have that work to do because of what we're seeing now with the introduction of the Delta variant and the other variants that are out there. The thing that we're noticing now is that with that Delta variant, that it's really going to work on our younger population, which is work age population, which is your employees. And we want to make sure that we're providing a level of protection to them. So you can see from the slide that you have in front of you, just to put some context into this, almost 91% of the current active cases, these are folks that were not fully immunized. Now, one of the things that we talk about is that, when we talk about the vaccination program, really the two biggest players is the Pfizer and the Moderna vaccine. To be protected against the Delta variant, we need to have both shots done. And why we bring this up and why I point this out is because right now in the state of Arkansas, about 15% of the people who have started the vaccination program never came back for their second shot. So really, they're very vulnerable, and we want to make sure that we're getting everyone vaccinated and inoculated. But also, just wanted, if you go back one slide, the other part is that here's the question about, is this effective? What the CDC promised us was a vaccine that was going to have an efficacy of about 95%. Right now, you can see right here that since January 26th, when we were at our peak, 3,765 Arkansans have been hospitalized, and 98.3 of them have not been given the shot. There have been just under 1,000 deaths, and 99.6 of those are not immunized. And so the point out of this is that there are a few breakthrough infections, but of that 0.4%, these were people that were older than 70, and their immune response to the vaccination was not there. And so that's what they capture in that efficacy number of 95%. So we're operating much better than we were promised. And this is the way to get protection against not only the parent of COVID, but what we see as that will be, by the end of the month, the predominant virus in the state, which is the Delta variant. So it's very, very important that everyone gets vaccinated. All right, so the next slide, this goes to what I was just talking about, is that, the empowerment of each of the companies and staying within those pathways of trust is so critically important. Some of the feedback that we're getting is that, and I understand this, is that people are tired of talking about this. They want to get back to normal. And they see the same talking heads, myself included, talking about the seriousness of COVID. And it is, but they kind of tuned us out. So a lot of what my effort is now is I want to empower the local communities. That's where we've had the most success. So by that, we started trying to show this week, what counties are doing the best and which counties are doing the worst in getting their populations vaccinated. And you can, as expected, if you take a look at the top 5, you see Washington, Pulaski, and Benton County are doing real well. Those are the large population centers that were disproportionately affected by the virus. But one of the things that I think is also very interesting is that 2 very, very small rural Delta counties are the very best in the state, with Bradley and DeShay County. Matter of fact, Bradley County, if they have to give under 100 more shots to meet the governor's goal of 50% of the population being vaccinated by the end of July. So I think Bradley County and DeShay County are going to be the very first to cross the finish line, or at least the start of the finish line. But you also see a lot of the counties on the right, like Miller County, and you see for a lot of these with Fulton and some of these other counties that these are border counties, and so some of it may be information that we don't have good data on. For example, Miller County is Texarkana, and all the major medical systems in Texarkana are on the Texas side. We don't have a data sharing agreement. Matter of fact, Texas has a law that prevents them from sharing data. So we know we got a blank spot there in Miller County. But, it just shows you that population doesn't necessarily mean it. It's the local engagement. It's that pathway of trust that gets us across the line. And that's really what I'm asking from you, is to engage with your employees and see what we can do about getting folks vaccinated. Next slide, if you don't mind. This is just a little peek of how the vaccination program has gone in June. And so what we've seen week to week, that we've seen about an 8% drop in the people seeking the vaccine. Actually, when I updated this, the last 2 days, we've had the best vaccination days in over 2 months. Altogether, we've got almost 19,000 new vaccines that got out over the last 2 days. And I do think probably it's because people are starting to hear about the Delta variant and the veracity of the illness, and how much sicker people are getting with the Delta variant. And so I think that's an important stat, but also I want to see that trend line actually going up rather than just stabilizing. And if you go to the next slide, and this is if you go one more, please. This is the fish graph that Jay was talking about, and really what I was wanting to be able to do is, since my words and the governor's words and Dr. Delahaye and Dr. Romero, We've all been talking about this and people aren't hearing it anymore. I just want the data to speak. Let people make an informed decision based on data rather than talking heads. So what I did is we've shown the percentage of Arkansans hospitalized from the beginning of the epidemic. And this is what I did. And if you take a look at the blue line is the population 65 and older. And the orange line is the group 25 to 48. That's your working age grouping. And so this really tells the story of the epidemic and how this has affected us in Arkansas. You can see at the very beginning in March, you saw that the hospitalizations for the older population was actually going down. And the reason why is that they were scared and they went into self-isolation and were socially distanced. Conversely, the working age group was still working. And so you saw their hospitalizations rising. And then you saw that in mid-May that we shut down the economy. And when we did that, the working age group, their hospitalizations to COVID actually went down. Whereas the elderly group that is the most vulnerable, they, because of their compromised immune systems and any kind of comorbid condition that they have, you saw theirs go up because now they were needing to get replenished of food and those kind of things. And so they were getting out a little bit more, and then you saw it really, really spike. We started the vaccination program in mid-December, and then you can see from that point on, the vaccination, the elderly group, their hospitalizations have dropped off, and it's getting steeper as we go. Conversely, we've kind of done away with the mask mandate, and we've kind of tried to get back to normal. And the working age group, their hospitalizations are going up. So really, the only thing that differentiates between the two of them is one group has been vaccinated and the other one hasn't. The elderly group has been vaccinated at a rate of about 73%, whereas the working age group has been vaccinated at a rate of about 23 to 25%. That's the only defining difference between those two groups, and those lines have now crossed. So now what we see in the hospital is more a younger group because of the Delta variant, which is anywhere from 300 to 700% more transmissible than the parent strain. These people are showing up and they're being admitted in the hospital in a much sicker condition, and so they're going through some really, really terrible stuff to get them healthy again. And so really my concern is that you guys are the backbone that makes the society tick. If these companies are unable to get their products to market, it's because their workforce is sick, then we as a society will stop. And from my background in the military, I always look at things through a national security prism. This is vitally important to us as a nation. And I will tell you that from my background, that one of the things that really frustrates me is the fact that I have the solution. I have the ammunition to attack this foe. I just need everyone else's help to get it into the arms of Arkansans so that we can get back to normal. And I'll stay on the line and answer any questions towards the end of it, but we'll let the smart guys talk now.
Thank you, Colonel Ader. Obviously, we count you as one of the smartest of the smart guys, and we greatly appreciate the work that you're doing. And obviously that graph does speak for itself and tells a story unto itself. And so Mike and Wayne, I'd like to bring you guys in and then also remind folks that if you have questions as we're going through this, please put those in the chat box so that folks can deal with them as they go through their presentation, because we may get to the end and not have a whole lot of time left. So please go ahead and add your questions as we go, or you think of them. So with that, thanks again, Colonel Ader. We appreciate your work. I want to step up to the plate now with Mike and Wayne. Your own. Take off.
Mike's muted, so there he is.
If you guys don't mind, I'm sorry, I don't mean to cut in, but there was one question real quick that is maybe a little bit different that maybe I can answer real quick. The question is, do those who have previously had COVID still need to get vaccinated? I've been being asked that a lot. And the answer is yes, most definitely so. And the reason why is you most likely, whoever had COVID before, most likely had the parent virus. And the immunity that you got from that is for the parent virus. It does not attribute to the variants that we're seeing now. So you have like no protection against these variants. And so that vaccination is what's going to give you that level of protection that you need to going forward.
Great. Thanks, Rob. And Jay, thank you all for having us on to help all the members of the chamber, our clients and others trying to navigate how to keep businesses open and productive in this environment. I told somebody this morning it had been 2 or 3 months I'd been rocking along, not worried about COVID, and all of a sudden here it's going to be a big part of my business for a while. So we're going to go through some of the guidance for employers for vaccinations and try to address some of the options that employers have and businesses have in dealing with their customers also, so that we can maximize keeping businesses open, minimize people getting sick. And so thank you all for already jumping in on the chat, and I'll take these 2 questions real quick and then let Wayne get on going with the PowerPoint. The first question, is there any indication how soon the FDA will give full approval? I was on an email string with some lawyers across the country this morning, and one of them, who is in DC, seemed to think that we're maybe 4 weeks out from Pfizer and Moderna getting full approval. That's not an authoritative source, but it's the first one I've heard put a timetable on it. And Lisa, I agree with you. We will eliminate many of the objections once that full approval gets to us. The second question is, can an employer require employees to wear a mask if they've not been vaccinated? The answer to that is yes. Many of our clients and businesses we're familiar with have said, if you're vaccinated, you don't have to wear a mask, but if you've chosen not to get vaccinated, you do have to wear a mask. So with that, I'll let Wayne, I'll let you get started with the PowerPoint, and then we'll kind of jump to questions as we go.
And Wayne, if you don't mind, just to add a little more color to what Mike just said, my conversations with the CDC says probably a little bit later than that. They're pushing, all the data is in for full approval, but they were telling me probably end of September, early October is probably the earliest we would see it.
There you go. So yeah, the first slide here is just like I said, just to outline. We're going to talk some more about masks. I'd add to the answer to the question there. I not only think you can, but I think you should. There's the latest OSHA guidance is coming within the last few weeks. It's come into lockstep with the CDC guidance, which is, not as much protection required for vaccinated folks that are, so long as they don't have any underlying increased risk to adverse outcome from COVID. If they're unvaccinated, they should continue to follow all the old tried and true guidelines we've had for the last year of, if you're indoors and can't ensure adequate social distancing and ventilation, then you should continue to wear a mask in those settings if you're not vaccinated. It's not necessarily a mandatory standard or a mandatory regulation that but it's OSHA guidance, and in that guidance they repeat over and over. They keep going back to the language of the general duty clause to provide a healthful and safe work environment free from known hazards. So I tend to believe that if an employer were ever to just totally disregard the OSHA guidance and were to be investigated or audited, they would be in some risk of a general duty clause violation in the event that they weren't following that the latest guidance. So let's proceed on here through and get to so yeah, the EEOC is the government, the federal agency, most of us know, that provides guidance and enforcement of the employment laws at the federal level, both the Americans with Disabilities Act, Title VII of the Civil Rights Act, and others. At the very beginning of this, they issued guidance related to the vaccine, which presumed that a private employer could require its employees to get the vaccine, but it went ahead and provided some, so long as top qualifications where you had to adhere to the Americans with Disabilities Act, the ADA, the religious discrimination provisions of Title VII, et cetera. Employer incentives become at the forefront as we got into the spring and the summer, and the guidance was updated on May the 28th to address those. The May 28th guidance doubled down and in the sense of it clarified once again that in private employers, it's within their discretion to require employees that are working in person, indoors, to get the vaccine, so long as there was provisions in those policies to comply with the ADA. So yeah, the $1 million question, can employers require it? They certainly can. We're going to talk about some tips for compliance if an employer takes this route. Number one would be, I think, to have a written policy so it's clear to the employees of what's required of them. Are they going to be required to show some proof, a card, which is permissible for them to be required to show their card? What's the time frame for this? Is it going to, given the regimen of the 5-6 weeks that you would need to complete the full cycle of shots from the two-shot vaccines, you need to be clear on what the timeline is. And then, to the extent that there is a medical reason or a religious reason why an employee is objecting to getting the vaccine, we recommend having just a form, so there's no question about what the employee's basis is for their request for an exemption, how long that exemption will be necessary. We're seeing some of these, a lot of these medical exemption questions under the ADA. The condition that's prohibiting the employee from getting the vaccine is transitory in nature. So it may be that only a temporary waiver is required. Early on, there was a lot of, before the research was fully developed and widely known, a lot of the requests for exemption were for pregnant and nursing mothers, which is obviously a temporary condition. So that's another one where a temporary waiver might be in order. And then arrange and provide resources for access, not as big a deal now, thanks to the good work of the colonel and his team. The access is now widespread in every county of the state and in nook and cranny, as he said. So at that point, you need to reach out to a pharmacy or other care provider in your area if employees are struggling with access issues to help, funnel them and steer them towards those access points to be able to achieve the vaccine. And I'd encourage you to do that, whether you had a policy that required the vaccine or not. That's, I think, just good in light of our topic here today and the status of the variants and the spike in cases and hospitalizations. We need to double down and remind employees of, hey, that the vaccine is free, it's accessible. We encourage you to get it, even if we're not requiring it. Here's how you do it, and hold their hand figuratively or even maybe literally, through the process, if necessary.
And Wayne, if I can jump in just real quick, what I will also say to everybody is that if you're struggling and would like to have an on-site visit, please let me know. I can coordinate all that and get the vaccine to bring it to your place of work.
It's great. Yeah, that's like I said, just we get into sometimes in a professional environment, we may take for granted that everybody, has a relationship with a pharmacist or a healthcare provider that they trust, that they're, willing to go to. But, in maybe some different communities or socioeconomic statuses and things of that nature, it's not always a given. So in those if your workforce meets that demographic criteria, what the colonel's saying is all the more important to make sure that you've provided, steered them in another good resource to do that is through the resources at vaccinatearkansas.com and the Vaccinate the Natural State initiative and program. A lot of good videos, handout materials, ideas for educating your employees and talking to your employees, and just trying to rebut, the enemy here. I would suggest to you is number one, obviously COVID, but number two is the internet. I mean, there's so much misinformation out there about the vaccines and the virus itself. There's no filter on it. Anybody can put anything on the internet. So we'll talk about near the end. And so it's hard and scary for a lot of employees to know how to process all that information and know who to believe and who to trust. And I think as employers in an HR capacity, it's important to have an empathetic ear to that. Number one, just, to try to counsel your employees to make the best decision for their own health and safety and the health and safety of your business, your customers, and on down the line. A lot of employees are still maybe confused about who pays for this, or am I going to be penalized if I have to miss work to get the vaccine, or because I have some symptoms in the 24 hours after getting the vaccine. I would encourage you to alleviate any fears about that if they need a day off to get the vaccine or to recover from a short period of symptoms, then that'll be no issue at all. Monetary incentives, frankly, we haven't seen a lot of good results either at the state level or at the employer level. If you do go that route, be aware that this EEOC guidance of recently might require you to comply with some of the to the ADA in that respect. And then also if there might be ERISA or HIPAA group wellness plan issues that are raised, because if there's a health contingent element to a benefit, then that brings in wellness program issues. Lead by example. Get the vaccine yourself if you're a leader in your business, and tell your story to your employees and colleagues about how it went for you. It was fine. It wasn't painful. It wasn't it gave you peace of mind. It allowed you to be more freely with your friends and family, and to go out and travel and do other things, and use some positive peer pressure in that respect to alleviate their fear, because the conspiracy theories abound about, well, this is, big brother government trying to control the population, or it's, or it's not safe, or it's at least not known yet or not whether it's safe. If someone that is respected and a leader in the business or in the community, maybe it's as the colonel said, a faith leader in the community, another business leader, a healthcare leader, a trusted physician in the community. I know, growing up in Morrilton, we had several of those top folks that are, just trusted and incredible sources when it comes to information about healthcare. And that's what this is. This is a healthcare public health question. This isn't a political question. You're not making a political statement by not getting the vaccine or getting the vaccine. It should be, we need to eliminate that kind of rhetoric and do our job as employers to responsibly push the correct narrative, which is this is a public health and safety issue. And that's where we're trying to steer the conversation. Just some information here, given the lack of effectiveness of the incentives. I won't belabor this too much and spend time on it, but just be aware there that there is some guidance if you're going to offer, small amounts of maybe money or gift cards or PTO or things of that nature, that there are some devil in the details of that. Just another reason why I've never been a big proponent of incentives, because there's just a lot of landmines for the unwary, both at the EEOC level and perhaps the IRS level, for if it's something that would constitute a group wellness program. So let's skip to the next slide here is a good one. This is a common question we got yesterday. Can an employer ask for proof of vaccine? Mike, you want to jump in here and coach us through this?
So yes, you absolutely can ask somebody if they've been vaccinated. The question, why didn't you get vaccinated, is a danger zone that we probably ought to stay away from. There's a lot of schools of thought. You can ask an employee, provide me your vaccination record, and of course the law would then require you to keep that record in the employee's medical file, segregated from their personnel file. I'm kind of the school that I've got an HR person, I've got a centralized person, and the employees can come in and they show their card and their name gets checked and they keep their card. We don't worry about making a copy of it that could get floated around. We just need to know yes or no, are you vaccinated? And as I think a lot of employers are starting to do, is to say, if you are vaccinated, you don't have to wear a mask. But if you are not, when you get up from your workstation, you have to wear a mask in common areas. Then there's the issue of how are we going to enforce that, and that can be anywhere from an honor system to if you have employees that wear name tags or badges, that they've got a sticker on there to say they're vaccinated. Let's move to the next slide. Obviously, there are limitations in requiring somebody to get vaccinated, and those are going to be with regard to an ADA issue, which might be an allergy issue that would cause them to have a reaction if they get the vaccination. And this slide shows you the different considerations. Generally, in an ADA situation, they have to pose a significant risk of harm to themselves or others, and you can't reduce that significant risk by a reasonable accommodation. I have seen a lot of proposed ADA limitations on getting vaccinated, but only a few of them that I would say were legit. And so the other accommodation would be to religious accommodations, and there it gets a lot more sticky because the EEOC is issued guidance that broadens substantially the definition of a sincerely held religious belief to one that is not hanging from the doctrine of any particular religion, but is a sincerely held belief of a life-changing nature. Very, very vague. Going to cause a lot of litigation going forward as far as what will be a religious belief that will need accommodating. So what we have to do is then accommodate an employee's inability to be vaccinated, and to safely accommodate it. You may have to consider remote work. You may, as Wayne was talking about, say, well, we'll waive it for this period of time while you're having this condition that's occurring, but then you have to get vaccinated. And what we always tell people in accommodation issues is think outside the box, because there are all sorts of potentials here. So I'll go through a couple here, and anybody chime in if they've got some good ideas, because the brainstorming is what we're all going to have to do to figure out how to skin this cat. So the one of the things in there that we can change workspace, and it may be that we've got a small group of people who refuse to get vaccinated, and we say you're going in the unvaccinated wing, and we're going to set aside this set of offices, and that's where you're going to work. And all of y'all can work in the same place. And if one of you gets sick, all of you are going to get sick. There's remote work, and let me back up. There's also some negative incentives that we can provide. For example, you could say, I believe, as a supplement to your sick time policy, that if you get vaccinated and you get COVID, or that breakthrough case, then we're going to give you paid time off that's not going to hit your bank. It will be extra free paid time off. If you get COVID and you're not vaccinated, you will not be able to use your sick leave or other PTO to cover that. I don't believe there's a legal problem with that, so long as we push that policy amendment out before an event happens. So we can negatively incentivize people to go get tested that way. Excuse me, to go get vaccinated that way. There's some ways we can get around. We can make the remote work for us, and let me propose one possibility. Now, there's a lot of workplaces it's just not going to work. Okay, that you can't get somebody to remote work, but most of us have found at least parts of our workforce that can work remotely. So what you could say is, if you do not want to get vaccinated, then we will allow you to work, and we'll do it in 30-day increments or 60-day increments, with the idea that at the end of the 30 or 60 days, we're going to reevaluate based on where we are. You can work remotely, but you're going to take a 20% cut in pay to do so. There have been a number of studies where employees have said they're willing to take a cut in pay in order to be allowed to work remotely. And we all know that our dry cleaning bills, our lunch bills, our gas bills, our parking bills are going to be less, and so we can make that as an accommodation for the people who don't want to get vaccinated. Obviously, what the perfect world says, the employer says, you are going to get vaccinated, or you quit, or you fire. And that's what the Methodist Hospital in Houston did. And they had a lawsuit, and we'll talk about that in a little bit. But the realistic problem we keep hearing from people is, if I've got 4 to 30 people who leave my workplace because they refuse to get vaccinated, where am I going to get their replacements? And I think that's the practical problem that's going to really be facing us, and is going to be the major hurdle we have. So I have a question, and the question and answer: is there any problem with allowing company travel only for those that are vaccinated? Yeah, I think that's okay. I mean,
I would say, yeah, I would agree with that. It's okay. The caveat I would have there is, if travel was basically an essential function of the job, then you would you could get into a situation where if you limited travel to those that are vaccinated, it might be that you've effectively made vaccination a condition of the job, because for a position where the employee could not do the job without traveling, that it was an essential function of the job. So we're kind of back to the first series of slides, where you can make it a condition of the job, but you might be needed prepared to go down an interactive process if there was a medical or religious objection raised. And to the same, I'd make the same point on to the question in the chat about negative incentives. My opinion would be, I think, and this, lawyers differ on this all the time. I do think you would need to go through some consideration of an accommodation if there was a legitimate medical reason why the employee could not be vaccinated in utilizing that method, because that negative incentive would be a term or condition of employment. And if the employee was not allowed to exercise that term or condition or enjoy the benefit of that term or condition, and the reason was because of a medical or religious reason, then you might need to consider, potential an exemption. But keep in mind, go ahead and mention this now. Mike's talked about the sort of the difficult nature of the religious accommodation and the religious, the sincerely held religious belief objection, and how hard it is to get your hands around that. The good news is that the employer's standard for what they're required to accommodate on that is much, much lower. In other words, what they might have to be required to do to accommodate a medical reason, they might not be required to do that same thing to accommodate a religious objection, because the standard is different. The definition is different. Anything that's more than a de minimis burden to the employer, they're not required to accommodate on account of a sincerely held religious belief. So, and de minimis is not strictly defined in the regs of the statute, but it is kind of what it sounds like. Anything that's more than de minimis is not something that the employer has to accommodate. Whereas for a medical objection or a medical exemption or a medical reason why the employee can't get the vaccine, what you might be required to do would be somewhat is anything that's not an undue hardship, as you at least have to consider. So all good points there. I think that, when you're talking about, the negative incentives, I personally would still, especially for medical issues, consider some potential exemptions.
Yeah, and so it's all based on your level of risk aversion. I think that there's a good straight-faced argument, as Judge Wilson would say, that if you enforce this negative incentive against anybody who doesn't get it vaccinated, whether they have an ADA issue, a religious issue, or just they believe QAnon, then you're treating them, you're treating the disabled person the same as the non-disabled person. And therefore, I think you at least, again, got a fair argument that you hadn't violated the ADA.
A couple more good questions in the Q&A, but let me pause here before we get to those and say one thing the EEOC is sort of pushing as a resource for employers to handle accommodation issues for medical reasons is something called the Job Accommodation Network. It's been around for a long time, but it's the acronym of JAN is kind of what it goes by. If you go to askjan.org is their website. I don't think that they're officially affiliated with the government or the EEOC, but the EEOC promulgates that for employers to, and encourages employers to use that resource to find and consider, as a tool in the interactive process to consider possible accommodations. So I would encourage you, even if you don't end up using something that you find on there, the fact that you've used it, I think could help you if you were ever in an investigation by the EEOC for one of these type of questions on an ADA accommodation. Are we allowed to not pay the unvaccinated employees who have to quarantine due to exposure? Yes, you are allowed to not pay them. Yeah, so it's not all the government paid leave options for COVID related quarantines and that have all expired, long since expired. And so if you made the decision to not pay that, that's fine. Question about an Arkansas statute on related to child immunization requirements. It's a good place here to stop and make the point too of, Mike mentioned the Houston Methodist Hospital case. The judge threw that case out. And one of the good points he made was that the hospital was not requiring people to get the vaccine. What the hospital said, and what employers will say, I think across the country in growing number is that you don't have to get the vaccine. We're not going to you're not going to get put in jail if you don't get the vaccine. But if you want to work at this workplace in person, indoors, then we're going to require, you have to get the vaccine as a condition of employment. it's not a mandate in the sense of you have to get it or else. It's the same. It's no different than a mandate of you have to comply with our dress code, or you have to comply with another work rule, or you have to work this particular shift. No one's saying that anyone has to do any of those things. You just have to do those things as a condition of your job, and you don't have any legal or constitutional right necessarily to your job, absent a contract or something of that nature. So it's not, these child immunization requirements are government requirements that the government imposes on children to be able to go to school. And that's totally different than what we're talking about with an employer mandate, where a private employer would say as a condition of employment, you have to be vaccinated to work here. And that Houston Methodist case, the judge, all sorts of arguments were raised. The plaintiffs argued that the hospital had violated the Nuremberg Code, which is an international law that deals with, it's a Nazi era international law that deals with experimental treatments, on individuals without their consent or knowledge, even in some cases. The judge called that argument reprehensible relative to the situation with the current pandemic and what the hospital was trying to do. So yeah, that was a first good test case. The plaintiffs have promised an appeal out of Texas and the Fifth Circuit, the federal circuit that governs down there. So we'll keep an eye on that. But so far, so good. The first real test case we had on a vaccine requirement for a private employer, the employer won the case and won it fairly easily, I would say. It addressed all the same arguments. Let's go forward a slide here, Tabitha. And, yeah, we've talked about the religious objections. So let's forward through on to another one. Things that aren't, religious or medical in nature. Basically, here's the point: you don't have to accommodate those. But here's kind of what I was getting to, the myth buster of, will the EUA, which is the Employment Use Authorization that the FDA is authorizing the current use of the vaccines under, says you can't require it. Well, that's false. What the EUA says is that the government can't require it. And the lawsuits right now that do have some legs all relate to public employers, government employers. And I do think, though, that does raise an interesting legal argument. For private employers, it does not. And the judge in Houston that threw the Houston Methodist Hospital case out made that point quickly and easily and clearly, that the EUA does not prohibit private employers from requiring the vaccine.
So Wayne, there's a question in the chat about the OSHA COVID plan for healthcare providers. Mentioned paid leave for employees who must isolate. Do we know if that will be like for FCRA paid leave, where the employer could receive payroll tax credits? I don't know the answer to that question.
I don't know the answer to that either. I know that some of the FCRA provisions were extended on a voluntary basis, where employers could voluntarily sort of opt in and take advantage of that tax credit. My memory is that was going to expire either in the spring or the summer. I'll be honest with you, I haven't studied that emergency temporary standard very closely. I hadn't had a lot of questions about that from clients. And so I don't know. I would ask your counsel, ask your accountant about that for sure, because I could very easily see that being something where there's some relief provided if they were going to require it, if there's going to be a requirement based on the OSHA emergency temporary standard. If people don't know what she's talking about there, that's exactly what it says, an emergency temporary standard that's specifically directed at healthcare providers. And if they know, if you know, like if that's something that you've probably had to deal with over the last year. And so just be aware that there is some paid leave requirements in that non-healthcare providers don't have to deal with at this time.
The person who asked that question, I'll look it up and let you know. We got another one, the Q&A on public collective bargaining agreements, and it would apply equally to unionized employers in the private sector. whether requiring the vaccine would be a term and condition of employment that would be required to be bargained over. My gut says yes. We have frankly not had that issue come up because there are so few private employers who are organized. But I think the NLRB would say you have to bargain over that.
And I think that you would, for the local governments out there, they would have the same issue I'm talking about, where while we're still in this EUA period, there'd be a real serious question of whether or not the local governments could require it as a condition of employment, I think, for police and fire. A couple of statutes, with a lot of vaccine passports, a couple of acts that were passed this last session that relate to vaccine passports. The flavor and the temperature of the legislator was they don't like them. And so they kind of jumped on the bandwagon, a lot of other southern sister states, and said, we don't want no vaccine passports in Arkansas. The good news I would say out of that is that it was limited for the most part, if not in all parts, to the public sector and public benefits, public rights, things like travel, entry into the state, education, other public services. There is an argument that vaccine, that a private business might not be able to limit its services based on a condition of having a vaccine passport. Mike and I agree that's probably not a fair reading of Act 1030, and it would probably not pass constitutional muster if it was a fair reading of Act 1030. And so, what I think you could get to a point where a business could say, we're not conditioning your entry into our facility or our interaction with our staff on the fact that you have a vaccine as a member of the public or a patron, but you have to choose either demonstrate some proof of vaccination, or we need you to wear a mask if it's indoors and socially distancing isn't feasible or can't be ensured.
Yeah, and I've seen signs lately saying if you're not vaccinated, put a mask on. We suggest you put a mask on. We've developed a sign here that we're starting to roll out to people who want to have a sign that says if you're not vaccinated, you have to put a mask on. And I believe that it's okay for a business to say, if you're not vaccinated, you don't come in. Now, there's going to be a natural resistance to that because there's going to be a lot of ripple effect problems. They're going to lose business for a period of time. But I look at it for a restaurant, and so if I go to a restaurant and I know that they're only allowing vaccinated people in, I'm more happy to go right now because I'm frankly a little concerned going to restaurants generally, given what's been going on the last month. But there are a dozen different permutations of what you can do and a million permutations of the problems whatever course of action you take causes, because how do you police it? A small business can do one thing that a Walmart or a Home Depot just cannot.
Tara makes a good point in the comments there. She thinks that the voluntary opt-in, what I call opt-in provisions of the FFCRA expire at the end of September. That sounds right. Tara knows her stuff, so she's probably right on that. We'll look at that to confirm that's the case. But I knew it was extended. It might have even been extended again based on the rescue plan. But so I think that we'll confirm that. But if you are voluntarily opting into the FFCRA paid leave and tax credit provisions, then that would apply here, where even your unvaccinated folks that have to quarantine would qualify for that. So you would need to continue to follow that policy until you decided to opt out.
Yeah, and so that brings up we're still flying by the seat of our pants. Everything changes all the time. Wayne and I were talking about we're part of a group, a global group of law firms that we've got a working group that we're going to have Saturday morning Zoom calls to try and figure out what people are doing so that we can come and promote the best practices of people all over that are trying to figure out how to get through this.
So guys, we're running up on the top of the hour. And first of all, I want to thank again everybody for joining with us in today's discussion. I especially want to thank our presenters, Wayne Young and Mike Moore with the Friday firm, as well as Colonel Ader with the COVID task force and all of the activities that he's engaged with. Obviously, we're still in the midst of this. We're trying to keep another significant surge from occurring, and this will, as you've just heard, continue to evolve. But the main thing that we know from especially the information Colonel Ader shared with us, the vaccine does work, and you just have to look at those numbers to confirm that. So thank you. We will be sending this information out to all of you and to all of our members, as well as to others, placing it on social media. And we'll be back with you in the not so distant future with updates. With that, stay safe. Happy 4th of July to all of you, and we really appreciate you. Have a great day.
Thank you, guys.